So things not to do before plastic surgery. For the most part, you want to cleanse your body as much as you can. Some people take prescription medication. I always ask you to let us know what these prescription medications are, and sometimes some of them we may want to stop a day or two, obviously with understanding of your primary care doctor before the surgery. But many of them you can actually continue all the way, even some of them up to the morning of the surgery. As far as things that you take that are not prescribed, over-the-counter medications, herbal supplements, multivitamins, many of these have a lot of ingredients that can affect your system while you're under anesthesia. So with good understanding of what they are, we'd like all of them to be stopped. If you take any diet medication, especially if they're stimulants, those should be stopped at least 3 to 4 weeks before the surgery. Some of the other diet medication that maybe, for example, are fat inhibitors or diabetic medications, some of those may not need to be stopped. So check with us regarding those. As for smoking, alcohol, all of those affect your system. Best is to stop all of that at least 3 to 4 weeks before the surgery. So what should you be doing before the surgery? So for the most part, as you know, first of all, read all the instructions that we give you. We give you detailed instructions. It's really important that you read carefully through every line and make sure that everything is addressed. And if you have any questions about those, ask us. But for the most part, you don't want to eat or drink anything after midnight. This is so you can actually have anesthesia. The only way we can do anesthesia safely is if your stomach has been emptied for at least 8 hours. Second thing is to take a shower the night before the surgery and the morning of the surgery. We give you a special type of soap. You could use your own antimicrobial soap or use ours. This soap will kill all the bug on your skin and will lower your risk for infection, especially if you're somebody who knows that sweats a lot or maybe has some difficulty with hygiene. This is really going to help us not have infection after the surgery. Most of the time the infection comes because the bacteria that normally lives on your skin somehow gets out of control and causes that infection. Other things is to wear comfortable clothing. For the most part, spend a relaxing day before your surgery. Don't eat any heavy meals because it will be in your system even after the surgery, and then you're going to have to deal with that problem of constipation or having to go to the bathroom, immediately after the surgery, and we don't want to have to deal with that. So the night and the day before the surgery, for the 24 hours, make sure you eat light food. Second thing is, and the final thing is, drink lots of water. Make sure you hydrate your body. That is really going to carry us through and is going to make sure your blood pressure is good after the surgery.